It happens in an instant. A sudden weakness in the arm, a slur in your speech, or a terrifying moment where the world just stops making sense. If you or a loved one has experienced a stroke, you know that the immediate aftermath is filled with one overwhelming, paralyzing question. Will I ever be the same again? The loss of independence, the sudden inability to walk, to speak clearly, or to use your hand can feel incredibly permanent. It can feel like a door has been slammed shut forever. But today, I want to show you why that door is not locked. Welcome back to Rehab MD Insights. I am Dr. Matthew Rhodes, your host for today. We are diving deep into the science of stroke recovery and the brain's greatest, most powerful secret weapon, neuroplasticity. We are going to explore exactly what happens to the brain during a stroke, how it reorganizes itself afterward, and the evidence-based rehabilitation strategies you can use to promote that healing process. Let's uncover the science of hope. To understand how the brain heals, we first absolutely must understand what happens when it is injured. Your brain is an incredibly hungry organ. It makes up only about 2% of your body weight, yet it consumes 20% of your body's oxygen and energy. It relies on a constant, uninterrupted flow of blood to deliver that vital oxygen. A stroke occurs when this critical supply is suddenly cut off. This happens in two main ways: an ischemic stroke, where a blood clot blocks an artery, or a hemorrhagic stroke, where a blood vessel ruptures and bleeds into the brain tissue. Without oxygen, brain cells rapidly begin to malfunction, and if blood flow is not restored, many will die. The neurons at the very center of the attack, an area we call the core, are the most vulnerable. This is why a stroke is an absolute time-critical medical emergency. If you ever suspect a stroke, you must immediately use the FAST protocol. Face drooping, arm weakness, speech difficulty. Time to call emergency services immediately. Getting emergency treatment as quickly as possible can save brain tissue and dramatically improve recovery outcomes. When neurons in the core are lost, the specific functions they controlled are compromised. Our brains are highly specialized. If the stroke hits your motor cortex, you might lose movement on one side of your body. If it hits areas like Broca's or Wernicke's area, you may experience aphasia, a profound struggle to speak or understand language. But here is where the hope begins. Surrounding the severely damaged core is a zone of tissue called the penumbra. The penumbra is severely compromised and stunned by the lack of oxygen, but it is not dead. It is clinging to life. In the days and weeks following a stroke, as medical treatments restore blood flow and brain swelling goes down, this stunned tissue can recover. This is often why patients see a rapid burst of spontaneous recovery in the first few months. But what happens when that spontaneous recovery slows down? How do we regain lost functions? For decades, the medical community believed a tragic myth. We thought the adult brain was completely hardwired. We believed that once an area was damaged, the function it controlled was gone forever. We now know this is fundamentally untrue. The brain is a dynamic, living, moldable ecosystem. And this brings us to neuroplasticity. Neuroplasticity is the brain's remarkable ability to reorganize itself by forming new neural connections throughout life. Think of your brain's neural networks like a massive, bustling highway system carrying traffic, your thoughts, movements, and words from one city to another. A stroke is like an earthquake that destroys a major bridge on that highway. Traffic stops. The connection is severed. You try to move your arm, but the signal hits a dead end at the broken bridge. Neuroplasticity is the construction crew. The brain cannot rebuild the exact bridge that was destroyed. Instead, it starts paving brand new side roads. Undamaged brain networks can partially reorganize and compensate for lost functions. Through a process called axonal sprouting, nearby healthy neurons form new branches. This reorganization is known as cortical remapping. It is a biological marvel, but it requires a massive amount of dedicated work. Building those new neurohighways takes time, and the timeline of recovery can be a deeply challenging journey. You will often hear about the plateau, a period usually around 6 months post-stroke, where the rapid, visible improvements seem to slow down significantly. Many patients are incorrectly told that wherever they are at this point is as good as they will ever get. Let me be clear. The idea that recovery completely stops after a few months is outdated. Recovery does slow down. The rapid healing of the penumbra is over, but neuroplasticity does not have a strict expiration date. Studies show that with the right stimulus, stroke survivors can continue to regain some function years after their initial stroke. The detour roads are just harder to pave. So, if the brain has this incredible ability to adapt, how do we encourage it? The answer lies in targeted rehabilitation. The brain learns what it does. You have to provide the stimulus to build those new connections. Here are the evidence-based pillars of promoting neuroplasticity. Number 1. Massive, focused repetition. Neuroplasticity is experience-dependent. To build a new neural pathway, you must practice a movement hundreds, even thousands of times. Repetition thickens the neural pathways, turning a fragile path into a stable connection. Number 2. Task-specific training. The brain is highly efficient. If you want to improve your ability to drink from a cup, you must practice the exact motion of grasping a cup and bringing it to your mouth. Number 3. Aerobic exercise. Even with limited mobility, safely elevating your heart rate under medical supervision is crucial. Aerobic exercise triggers the release of a protein called BDNF, brain-derived neurotrophic factor. Think of BDNF as a fertilizer for your neural connections. It helps create a brain environment that supports neural adaptation and growth. Number 4. Sleep and emotional health. The actual physical rewiring of your brain happens while you rest. Poor sleep actively hinders neuroplasticity. Furthermore, post-stroke depression is incredibly common and detrimental to recovery. Supporting emotional health is just as clinically important as physical rehabilitation. Recovering from a stroke is one of the most difficult challenges a person can face. It requires immense patience and resilience. But please, remember the science. Your brain is designed to adapt and reorganize. The journey is long, the repetitions are exhausting, but progress is possible. Be patient with yourself, celebrate the microscopic victories, and keep moving forward. One more important thing before you go. This video is intended for general, educational, and informational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. Stroke recovery varies significantly between individuals, and outcomes depend on many medical factors. Always seek immediate emergency care for possible stroke symptoms and consult a qualified healthcare professional regarding rehabilitation, exercise, or treatment decisions. If you found this information helpful, please like this video, share it with someone who might need it, leave a comment, and subscribe to Rehab MD Insights for more deep dives into medical science and rehabilitation. I am Dr. Matthew Rhodes. Keep fighting and take care of yourselves. See you in the next episode. Take care.